Today I'll be sharing with you a little understanding of fascia. Now, what is fascia? Fascia is a connective tissue that envelopes your entire body. So it has a 3D dimensional effects that run around your entire body, and it also helps to support your joints, your bones, your ligaments, and your muscles. Okay, the props that you require for fascial release is very simple. All you need to do is to have a yoga blocks and a yoga mat, and you may want to arm yourself with a therapy ball. I favor a peanut ball like this. If you don't have a peanut ball like this is a therapy ball. You can have 2 tennis balls and put the 2 tennis balls into a socks and then tie the 2 corners, and you get a peanut shape like this. Yeah? So this will help you to relax your fascial tissue. Okay? So first thing first, let's try and relax our round shoulders. Okay? So your round shoulders is often shape your body into this slouching back. So how do you correct your tight fascial tissue around the shoulders? So this will be a very simple movements that you may want to try at home. Okay, corrections of a rounded back, right? So basically, if you look at the human anatomy, the back is connected with your neck into the shoulders, the T shape of the shoulder. So these are the 2 very important areas that you need to release in order for you to have a open shoulders. All right. So I will put the fascia ball, one over here, okay, and another one over here. Alright, so I'm going to get Aaron to lie down on his back, and just lie down by bending your knees, okay, and then just on a relaxed state. Okay, so I'm going to insert 1 tennis ball over at his upper traps and another tennis ball into his upper traps. Just relax when you are there, and then once you stay there, you may want to elevate by sitting onto a block. So raise the bottom up, okay, and then palms by the side, okay, and then just rest onto the block and then just relax onto the blocks. Alright, now sometimes I get my participants to reach the hands above the head. So this is one of the way, because if you're on tennis ball, sometimes your tennis ball run away. Okay, so gently just relax your arms along the side and gently just rotate your shoulder left to right, right to left. So the movements on the shoulders will create some massage into the upper trapezius area, so all your upper traps and your shoulders. Okay, so you can do this at home, all right? When you wake up or before you go to bed. This provides an extremely good release on the tight shoulder joint, tense shoulders, and at times when we are tired, you may want to just rest onto the tennis ball or onto therapy ball like this. Okay? Right, so how do you feel, Aaron?
Sure.
Okay, now how long? The next question is how long am I going to stay here? Alright, now usually I would encourage participants to stay here for about maybe 2 to 3 minutes. Right, and or as long as you find that there's some release at the shoulders, you can switch your points to other area, other fascia point area. All right. Okay. So next, I will be changing the pressure point. I'm going to shift Aaron and relax Aaron's neck. Okay, so that's a neck corrections for protruding the neck forward. Okay, so relax your arms, put them forward. Okay, so I'm going to just take off the tennis ball, and then you're going to lift up your head and then position it right over, okay, rest it, right over at the roots of your neck here. Okay, so, and again, you may want to stretch your both hands above your head, or you can relax your arms, so whichever that you're comfortable. So hands above the head, or relax your arms forward, bringing your arms back, okay, and then at the same time, move the shoulders a little bit. So as you move and drop your shoulders left to right, right to left, we're going to create some nice release at the back of the neck. Okay, so how do you feel? Yes.
Very good.
Yes,
it's
very good.
Releasing my tightness.
Tightness at the roots of your neck. So in anatomy, it will be at your C6. Okay, cervical vertebra. Okay. Now, do stay here, for about 2 minutes before you switch into another point, okay? So the next point that is always linked to your cervical vertebra will be the middle part of your neck, okay? So you can just lift your head up and then bring it to the center part of your neck, okay? And then on these postures, okay, you can hold here or you can just gently move your head around, just say no to your head, and then so that you can feel that when you're turning your head, you are actually moving your neck muscles and your neck fascia tissue also, yeah? So this will be a very, very nice release pressure point, and at the same time release the back of your fascia tissues, yeah? So again, so stay here for another 2 more minutes, and then before we switch it to another point. So the next positions will be your underarms, okay? So that's the back of the beginning part of your latissimus dorsi. So slightly tilt your body towards me. Okay, so this is where you pinch it. When you pinch it, this is the exact point that you should position your tennis ball, alright? So slowly place your tennis ball, position the tennis ball over here. Yes, and rest it. Now turn your body out, okay, slightly towards one side. Okay, you can just support your head with a yoga block and rest it there. So how do you feel?
A little bit painful, but
Yeah. So the pressure point area will be definitely a little bit more painful because if your body threshold level is not there, anytime when the body and the fascia tissue is being put into that ball, you'll find that there's some kind of like a pinchy effect, at that particular area. So basically, you're just releasing the blood circulations into that pressure points, yeah?
it's like having a massage.
Yeah. So in these positions, you can just gently move your shoulders so that you can just work into that rolling. So one of the fascial release is that you can put your body on a roll, so it's a massage. Okay, so another alternative is we can lift your hands up and just do some holistic movements. Okay, you just need to do a pulses like this. Okay, so and then continue to work on that. Now, breathing wise, you can just breathe out through your mouth by doing this. Shh, 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 shh. Yes. Okay, 10, 9, 8. Continue with this movement so that it creates a lot of fluidity into the fibrocysts and into the fibroblasts. Stretch out your hands to the back. Yes, and then straighten your elbow and then just do a simple flapping like this. Okay, so slap towards your palms. Okay, so this is one of the movements that help you to release the fascia tissue in a more therapy movements. Yeah, so it's like a therapy. The next one will be the extension. So see the baby finger, lift it up. Okay, so reaching it up. So the front movement is working on your deltoid, anterior deltoid. The back movement is working into the back of your deltoid muscles and also the fascia tissue around the shoulders, as well as the pressure point into the insertion origin of your latissimus dorsi area. Okay, now keep breathing. 4, 3, 2, 1, and relax. Alright, now next we're moving into the stretch of the shoulders to open up your shoulder blades. Okay, so position your belt behind with the both palms facing the back. Yes, and then gently inhale your chest up. Good. Exhale, straighten your elbow and reach your palms away from the body. And then try lean forward, lean forward. Yes, at the same time, you only want to lift to the level that you're just comfortable with. Okay? So hold there for a few reps of your breath. Okay? Inhale and exhale. And try to relax your chin down so that you can relax your neck. Okay? 5, 4, 3, 2, 1, and release it. Yes, and slowly sit up. So this will be the simple fascial release to correct your round shoulders. At the same time, it corrects your protruding neck. Alright, so now we're moving into the spine because basically the whole of your spine will correct your entire back. Alright, your elbow palms behind your head like this, and then tilt the elbow out. Okay, so this is where you find there's two pieces of wing that's sticking out. So that's your scapular wing. So positions your tennis ball side by side in the middle of your two scapular wings. Alright? So this is where the main part of your rhomboid muscles comes in. And then just check on his exact positions that he needs to place over at his scapular wing. So do self-adjustment. You can bring your hands behind and then adjust the ball and see if the ball is in the right position. Yeah? Okay? Now once you are there, all you need to do is just relax. Okay, so relax and let the baby toes fall out and the palm facing up. So next we're moving into the rolling. Okay, so rolling is very easy. All he needs to do is cup his finger next to the ear. Okay, so remember, this is not right. Okay, placing the full palm flat is not right because it's too strenuous onto his wrist flexor muscles. Okay, so all he needs is just doing a simple cupping, fingertip only. Yes, so fingertip, just so that when you bend your legs, so draw your heels towards your buttock as you bend your legs. You are using a slight core muscles, to work on the rolling. So lift up your head slowly, lift up your buttock slowly, and just do a gentle roll up and down. Yes. For beginners, your movements may not be too fluid in a way, and sometimes you find that you do not have the required strength to stay there for slightly longer time. Don't worry, okay? So all you need to do is just massage. When you're tired, you just rest. Okay, so there's no fuss about the whole thing. So next point would be at the rib cage. Alright, so it's the back of the rib cage. So if you run from the ribs, this is the lowest part of the ribs. From the side, the lowest part of the side ribs, and it runs into the back ribs. So positions the ball just exactly, alright, between both part of the left and right lower ribs area. Okay, so yes, self-position it now into the lower rib cage in the middle of your spine. Okay, so you can lie down first, and then again you can just raise your buttock up. Okay, so relax first. Okay, so hold there for a while. Yes, and then yes, so you can lift your buttock up and use your hands to insert under to adjust the ball's positions. Okay. So no issue at all, as long as you're comfortable and you find your own sweet spot at that actual area, okay? So when you lie down and you manage to find that sweet spot, all you need to do is just shift your buttock left to right, right to left, yes. And then you'll find that, the body weight is actually pressing into the therapy ball and helps to release the blood pressure into that pressure point, and help as you roll, it helps to release your fascia tissue. Okay, so ready to roll. Now bend your legs, cup the fingers, yes, and bend your knees. Lift the head up a little bit and then gently just roll up and down. Yes, very nice. Okay, so that's so wonderful. The moment you get used to this momentum, you'll find that rolling is just a piece of cake. Yeah, so it's so easy. Okay, so how long you're going to stay there? So same thing, roll until you find the back is completely released. Alright, so the next point, okay, so you can lie down your back. So next point we're moving down will be just above the belt line. So assuming this is the belt, alright, you're going to position it just above the belt lines. Alright, so this is another pressure point. Okay, so just, above your own belt. Okay, so lie down your back and then just rest into the belt line. So coming to fascial therapy class, this is definitely a very relaxed class. So there's no pressure, there's no intimidation, and then all you need to do is just acquire these techniques, and you can practice these techniques at home anytime, and also you can, for those who are working from home, you can just step out, from your desk now and just do this simple fascial release. Okay, so another alternative of the straight leg would be you can bend your knees, so step in, bend your knees, and then sway your knee left to right, right to left. It's like rocking your knees, yes, that's right. So this will be another alternative to release the back of your fascia tissue. Okay, so ready to roll, cup the finger next to the ear. Okay, lift up your head slowly and then gently just roll up and down into the sacrum. Okay, you need to raise your bottom up a little bit so that you can bring your feet closer. Yeah, so that you can just massage it. Yeah, into the sacrum, especially on our lower back. It can be quite taxing when you sit for too long, when you stand for too long. Yeah, so these are the fascial release that help you to shape up, you know, and gives you a very strong support into your muscles using the fascia. Okay, so you can relax and let go. Okay, palms facing out and relax when you are there. So that wraps up your entire shoulders and corrections of your postures. So this will be the fascial release for your body postures, especially your torso area and your shoulders. Yeah. So how do you feel, Aaron, after you have released it?
I feel like my whole spine has been stretched out.
Yeah, exactly.
Very relaxed.
Yes, and again, it's a very different feeling between major muscle group stretch and a fascial release. Now, we're moving into your fascial ballistic movements. Okay, so ballistic movements could be very simple. You can stretch out your legs and do a sit and reach. Yes, so when you're doing the sit and reach, you'll find that the back of the fascial tissues is doing a springy extension. Yeah, so it's like a spring pulling back the whole of your back muscles. So remember 3D spider web effect, where the fascial tissues are moving around into the back of your columbar, so which is the lower back here, spinal extensor. Yeah, so the more you do, the more it releases into the back muscles. 5, 4, 3, 2, 1. Okay, now reach there and hold there, and you find that just relax your arms on top. Yeah, flex the toe, and you find that your back extensor starts to work for you, not against you. Okay, very good. And then gently cross the legs. Good job. So that wraps up the corrections of your postures for your fascia tissue. Yeah. So this is Agnes wrapping up, and I have Aaron with me, and thank you very much. Bye.
Bye.